Welcome to the deep dive. Today, we're focusing on something really fundamental to how we, see everything around us,
Mhm.
our eyes.
hmm
We're taking a deep dive into ophthalmology, which is the branch of medicine all about the eye and the visual system.
Exactly. And we've
Okay.
got some, well, really interesting sources to dig into this. We'll be looking at an opinion piece that gives a nice, concise intro,
Okay.
then a more detailed, essential guide to eye health and diseases, and also the Wikipedia entry on eye disease, which classifies things.
Right. So a few different angles. Our mission today is basically to pull out the most important, maybe the most fascinating bits from these to give you a really solid understanding of ophthalmology.
Sounds good.
Okay, so first things first. What exactly is ophthalmology?
Well, in essence, it's a surgical branch of medicine. It focuses on diagnosis, treatment, and also prevention of diseases and disorders that affect our eye.
Surgical branch?
Okay, so that's key. Yeah, and what's really worth noting is that ophthalmologists, they're medical doctors, MDs, who've done quite a bit of postgraduate training specifically in medical and surgical eye care.
Ah, so they cover both sides.
Right. They're equipped for, everything from just a routine eye exam right up to really complex surgeries. And they often get involved in academic research, too.
Makes sense. Always learning more about the eye. Okay, let's dive into some of the common eye diseases and disorders they deal with. I think some of the details on their impact might surprise you. Let's start with cataracts. We hear that term a lot.
Yeah, we do. And what really stands out from the sources is just how common they are as a cause of vision problems.
How common are we talking?
Well, globally, they account for about a third of all visual impairment and, get this, over half of all blindness cases.
Wow, over half. That's huge.
It really is. And the symptoms, they're not just, general blurriness. People might see halos around lights.
Oh, interesting.
Yeah, like a sort of diffraction effect from the cloudy lens. Colors can seem faded, and night vision often gets worse.
Which I imagine really impacts everyday stuff, like driving at night, or even just reading in low light.
Absolutely. And the sources also point out that cataracts can, unfortunately, increase the risk of falls, probably because depth perception gets tricky and can even lead to feelings of like isolation or depression because it affects independence.
Yeah, I can see that. Okay, what's another common condition ophthalmologists handle?
Excessive tearing. The clinical term is epiphora.
So more than just, crying.
Right, exactly. While you might think allergies or something emotional, often the issue here is actually inadequate tear drainage. The tears just don't drain away properly through the ducts.
Ah, so it's like a plumbing issue in the eye.
Kind of, yeah. Instead of draining, they just overflow and run down your face.
Okay, what else?
Then there's thyroid eye disease, sometimes called Graves' ophthalmopathy.
Graves' disease, like the thyroid condition.
Exactly. It's an autoimmune thing where the body's immune system mistakenly attacks the tissues around the eyes and inside the eye socket.
That sounds like it could cause some noticeable physical changes.
It definitely can. Some key signs are things like the upper eyelid retracting, which can make the eyes look wider, more, startled,
Right.
and the eyelid might lag when looking down, and sometimes the eyeballs themselves actually protrude forward. That's called exophthalmos. It's seen more often in people who already have Graves' disease affecting their thyroid.
Okay. Moving on, our sources also mention eye tumors. That sounds pretty serious.
It can be, yeah.
Hmm.
But it's important to note they can be benign, so non-cancerous or malignant.
Right.
Sometimes cancer starts in the eye, that's primary eye cancer, but other times, sadly, cancers from elsewhere, like breast or lung cancer, can spread to the eye. Metastasis.
That's quite sobering. Really shows how interconnected everything is in the body.
Definitely.
What about diabetic retinopathy? We hear a lot about diabetes affecting eyes.
Yeah, that's a big one. Diabetic retinopathy is basically damage to the tiny blood vessels in the retina, the light-sensitive bit at the back of the eye.
Caused by the diabetes itself.
Yes, directly. Over time, this damage can lead to vision loss, even blindness, if it's not caught and managed well. Really underlines why good blood sugar control and regular eye checks are so vital for diabetics.
Absolutely. And then there's dry eye syndrome. I feel like almost everyone's had that feeling sometimes.
Oh, for sure. Dry eye syndrome or keratoconjunctivitis sicca, if you want the fancy term.
Chuckles slightly.
Okay?
It just means the eyes aren't producing enough tears or the tears are evaporating too quickly.
Leading to that gritty, uncomfortable feeling.
Exactly. Symptoms can range from just mild irritation, that gritty feeling, to pretty significant discomfort. And in bad cases, it can actually damage the cornea, the eye surface.
Wow. Okay, so it can be more than just annoying.
It certainly can. Next up is glaucoma, another one people often link with serious vision loss.
Right. What's the main thing to understand about glaucoma from our sources? Well, glaucoma isn't just one single thing. It's a group of conditions. But what they have in common is that they damage the optic nerve, which is like the data cable sending visual info from the eye to the brain.
And that damage is often linked to eye pressure?
Often, yes. It's frequently associated with increased pressure inside the eye, intraocular pressure, or IOP. But here's the tricky part. The most common type, open-angle glaucoma, often has no symptoms in the early stages.
Oh, so you might not even know you have it.
Exactly. Not until significant irreversible damage has already happened, which is why those regular eye exams where they check the pressure are so important.
Right, a silent threat. Okay. And finally, you mentioned macular degeneration.
Yes, age-related macular degeneration, or AMD.
We hear about that mostly in older people, right?
That's right. It affects the macula, which is the very central part of the retina.
Mm.
It's responsible for our sharp, detailed central vision, the kind you need for reading, recognizing faces, that sort of thing.
And what happens in AMD?
That central area, the macula, starts to deteriorate. This leads to blurred or even missing vision right in the center of your view. And sadly, it is a leading cause of vision loss in older adults.
Gosh, that's quite a list of potential problems. It really drives home how complex and, well, delicate our vision system is.
It really is.
So, how do ophthalmologists figure out what's actually going on? What kinds of exams and diagnostic tools do they use?
Okay, this is where the science gets really cool. They have a whole toolbox, really, to check every aspect of eye health and function. Let's start with the most familiar one, the visual acuity test.
The eye chart, reading the letters.
Exactly, the one where you read down the rows of letters. But it's measuring more than just how well your eye focuses.
Oh.
Yeah, the sources explain that visual acuity depends on both optical factors, like how sharply the light focuses on the retina, and neurological factors. So the health of the retina itself, the optic nerve pathways, and even how the brain processes the signals.
I see. So it's testing the whole system, not just the lens focusing.
Precisely. Then there's ocular tonometry.
That sounds technical.
It's the test that measures the fluid pressure inside the eye. The intraocular pressure, IOP, we mentioned with glaucoma.
Right. Okay. How do they measure that? Is that the puff of air test?
That's one common way, yes, non-contact tonometry. Or they might use a device that gently touches the cornea after applying numbing drops. The goal is to get that pressure reading. Our sources say the typical normal range is about 10 to 21 millimeters of mercury, mmHg.
Okay, so they get a number to compare. What else do they check?
They'll evaluate extraocular motility and ocular alignment. Fancy words for checking how your eye muscles are working.
The muscles that move the eye around.
Exactly. There are actually 7 muscles attached to each eyeball controlling movement and also eyelid position. They check if your eyes move smoothly together in all directions, which is crucial for tracking things and for depth perception.
Makes sense. Got to make sure the hardware is moving correctly. What about getting a really close look at the eye structures?
For that, the key tool is the slit lamp.
Ah, yes, I've had that one. It's that microscope with the bright light they shine in your eye, right?
That's the one. The slit lamp uses a very focused, narrow beam of light, the slit, and a powerful biomicroscope. It gives the ophthalmologist a highly magnified 3D view of the structures at the front of the eye.
Like the cornea and the iris.
Exactly. Cornea, iris, lens. It allows for incredibly detailed examination to spot problems there.
Okay, so that covers the front. But what about the back of the eye, the retina and optic nerve?
Right. For that, they need different tools. One really important technology is optical coherence tomography, or OCT.
OCT, I think I've heard of that. What does it do?
Think of it like an ultrasound, but using light instead of sound.
Okay.
OCT uses low coherence light to create incredibly detailed cross-sectional images of the retina and other tissues. It's like getting a microscopic slice view.
How detailed.
We're talking micrometer level resolution. You can actually see the different layers of the retina. It's fantastic for spotting subtle changes that signal disease, sometimes before symptoms even appear.
Wow, that sounds incredibly precise.
It really is. Then moving on, there's electroretinography, or ERG.
Electroretinography, what's that measuring?
It measures the electrical responses of the different cells in the retina when they're stimulated by light. So the photoreceptors, rods, and cones, and other cells like the ganglion cells.
Yeah.
Tiny electrodes are placed on the cornea or nearby skin to pick up these signals.
So it's checking if the retina's electrical system is working correctly.
Basically, yes, how well it responds to light. And similarly, there's electrocalography, or EOG. That measures the standing electrical potential between the front and back of the eye. It's used for tracking eye movements, but also helps diagnose certain retinal conditions.
Okay, quite a few electrical tests there. And finally, you mentioned visual field testing earlier. I think I've done that one pressing a button when you see a light flash.
That's likely it, yes. Visual field testing essentially maps out your peripheral vision as well as your central vision. It looks for any blind spots or areas where vision is reduced.
And what causes those blind spots?
Various things can cause them. Glaucoma is a big one, but also stroke, sometimes tumors pressing on the optic pathways, other neurological issues. The tests can range from simple confrontation tests where the doctor just uses their hands to sophisticated automated machines called perimeters that flash lights very precisely.
It's really quite amazing the range of tools they have just to assess vision, from a simple chart to this advanced imaging and electrical testing.
It really is a sophisticated field.
So let's say a problem is found using these tests. What about treatment? What surgical options do ophthalmologists have?
Oh, surgery in ophthalmology has made huge leaps. There's a whole spectrum of procedures to restore vision, fix refractive errors, treat diseases. The most common one by far is cataract surgery.
Right, removing that cloudy lens we talked about.
Exactly. The clouded natural lens is removed and usually replaced with a clear artificial one, an intraocular lens, or IOL. The standard technique now is often phacoemulsification.
Defico what now?
Phacoemulsification. It uses ultrasound energy to gently break up the cloudy lens into tiny pieces, which are then suctioned out through a very small incision. It's minimally invasive.
Less invasive is good. And then there's refractive surgery like LASIK, which seems really popular for glasses and contacts.
Very popular. Procedures like LASIK and PRK use lasers to precisely reshape the cornea, that clear front window of the eye.
To fix nearsightedness and things like that.
Exactly. Nearsightedness, farsightedness, astigmatism. The goal is to correct those refractive errors so light focuses properly on the retina, reducing or even eliminating the need for glasses or contacts.
Okay. What about surgeries for conditions like glaucoma, dealing with that eye pressure?
Yeah, there are several surgical approaches for glaucoma. The main aim is always to lower the intraocular pressure to protect the optic nerve. Traditional surgery like trabeculectomy creates a new drainage channel for the fluid inside the eye.
A new drain, essentially.
Pretty much. But there are also newer options called MIGS, minimally invasive glaucoma surgery. These use tiny devices, stents usually, to help improve the eye's natural drainage system, often with less risk than the traditional surgeries.
Interesting. And for the back of the eye, problems with the retina or the vitreous gel inside?
That falls under vitreoretinal surgery. These are often very complex, delicate procedures.
What kind of conditions do they treat?
Things like retinal detachment, where the retina pulls away from the back wall of the eye that's an emergency.
Yeah.
Also, macular holes and complications from diabetic retinopathy, like bleeding inside the eye or scar tissue pulling on the retina.
Wow, sounds intricate. The sources also mentioned corneal transplants.
Yes, keratoplasty. That's when a damaged or diseased cornea is replaced with a healthy one from a donor. It can restore sight when the cornea has become clouded or misshapen.
And what about surgery on the parts around the eye, like eyelids?
That's oculoplastic surgery. It's a subspecialty focusing on eyelids, tear ducts, the orbit, the eye socket, and surrounding areas.
What kind of procedures?
Things like blepharoplasty, which is eyelid surgery, often done for droopy eyelids.
Oh, okay.
Repairing blocked tear ducts, treating aposis, which is a droopy eyelid muscle issue, even reconstructing the eye socket after an injury or tumor removal.
Right. And fixing crossed eyes or misaligned eyes.
That's strabismus surgery. Strabismus is the medical term for eye misalignment. The surgery works by adjusting the length or position of the eye muscles on the outside of the eyeball to get the eyes working together better.
Can that be done in adults too, or just kids?
Oh yes, it can be effective in both children and adults.
Yeah, okay. It really is a comprehensive list of surgical fixes. Seems like there's a procedure for almost every part of the eye system.
There really is.
Wow.
And, to just get a sense of the sheer scope of it all, that Wikipedia source mentions the ICD-10 classification system.
Oh yeah, the big medical coding system from the World Health Organization.
That's the one. There's an entire chapter in ICD-10 just for diseases of the eye and the surrounding structures.
An entire chapter.
Yep. It breaks down into detailed categories for disorders of the eyelid, the conjunctiva, the cornea, the lens, glaucoma, retina, optic nerve issues, visual disturbances.
Yeah.
Just tons of specific codes.
Wow. It really highlights just how many different things can go wrong with our eyes, doesn't it?
It absolutely does. Kind of mind-boggling when you see it all listed out like that.
Definitely. So, okay, with all these potential issues, What are the practical things we can actually do to try and keep our eyes healthy? What
Mhm.
do the sources recommend for prevention?
Right. Prevention and just good eye health habits are super important. The forces hit on several key things. Eating a balanced diet, particularly one rich in antioxidants and vitamins like A, C, and E, seems beneficial.
Good diet helps everything.
Yep.
Makes sense.
Yeah. Also, protecting your eyes from UV light. So, wearing sunglasses that block UV rays when you're outdoors, that's a must.
Okay.
And a big one, avoiding smoking. Smoking significantly bumps up the risk for serious conditions like macular degeneration and cataracts.
Right. Another reason to quit or not start. Those sound like general health advice, too.
They really are. Good overall health often translates to good eye health. Other tips include taking regular breaks when you're staring at screens for long periods. The 20-20-20 rule is often mentioned.
Look 20 feet away for 20 seconds every 20 minutes.
That's the idea, yeah. Helps reduce eye strain. Also, managing chronic conditions is key, especially diabetes and high blood pressure. As we've seen, they can directly impact the eyes.
Right.
And probably the most crucial piece of advice, get regular, comprehensive eye exams, especially after age 40 or sooner if you have risk factors like diabetes or a family history of eye disease.
So really, it's a mix of lifestyle choices and making sure you get those professional checkups.
Precisely. Early detection makes such a massive difference for so many of these conditions. Catching things early often leads to much better outcomes.
Well, this has been incredibly eye-opening, no pun intended. To sort of recap, ophthalmology is this huge, vital field dealing with our eye health. It covers this vast range of conditions, uses some really sophisticated diagnostic tech, and offers a whole suite of treatments, including advanced surgery.
Yeah, and the take-home message really is that prevention and early detection are key.
Absolutely. Taking those proactive steps is crucial for keeping our vision healthy for as long as possible.
It's an excellent summary, and it just underscores how important it is to, appreciate and look after these amazing sensory organs. They're so critical to how we experience the world.
Definitely. So, thinking about how intricate the eye is and how it connects to our overall health, it makes you wonder, doesn't it? What other, maybe seemingly unrelated changes in our bodies might actually give us early clues about our vision? And looking ahead, how might new technologies continue to change how we diagnose and treat eye
Huh.
problems?
Interesting questions.
Yeah, something for you all to think about. Consider that delicate balance of the visual system, and maybe think about those proactive steps you can take to protect yours. Thanks for joining us for this deep dive.